Hello everybody. Hi. I am Dr. Soumitra Dutta. I'm a pediatric consultant based in Kolkata. Today I'm going to talk to you about the newborn baby. There are certain things that mothers need to know, and I'll try to clear up some myths and misconceptions today. Like, for example, there are a lot of things which seem actually abnormal in a small baby, but are basically within normal limits. For example, a baby might sneeze about 30 times per day. That does not mean that the child has got a cold. And there's a lot of blockage in the nose. That's because of the fact that the passage is small and there's plenty of mucus inside the nose. That's normal. So obviously there'll be a lot of blockage. Sometimes you might put the baby on the chest and you might feel a little bit of vibration. That's normal. That's basically because of the fact that the baby lacks a lot of cartilage, a lot of muscles, and so the transmitted sounds from the chest comes in. So that's normal. The baby may constantly have hiccups. That doesn't mean that the baby needs water. In fact, no baby needs water, whether breastfed or bottle fed, for the first 6 months. The sleep pattern of the baby is very erratic. It depends to a very great extent how the baby used to move inside the mother. So if the baby used to be sort of kicking around inside the mother in the night, the baby would be awake in the night, disturbing more in the night, would be passing loose stools in the night, would be feeding much more in the night. So it depends to a very great extent on the biological clock of the baby. Sometimes babies do sleep through the whole day and are awake through the whole night. The sleep pattern is erratic. Sometimes they would sleep for 4-5 hours. Sometimes they will sleep for 15 minutes and get up. The feeding pattern too is very erratic. Sometimes they will keep on gulping feeds. Sometimes they will go off to sleep within 2 minutes. So these are normals. Babies do vomit a lot. Sometimes we call them possets. They are basically nothing but milk regurgitating from the mouth. Sometimes that might come soon after a feed, or it might come about an hour after feed, and that might be pure milk which might drop out, or sometimes it might be curdish, it might be offensive smelling. It's basically milk goes in, you got HCl or hydrochloric acid in the stomach, it's converted into curd, so when the baby regurgitates, the curd comes out. So there's nothing to get worried about it. Babies swallow a lot of air. So the air goes into the stomach. There are two exits. It can escape from the top, which we called burping, and it might escape to the bottom, which we called gas. So don't get so much obsessed about the baby passing gas. Don't get worried so much about gas. Accept that as a normal thing. The urine of the baby is also very very erratic. Sometimes they would pass 3 or 4 urines. Sometimes there'll be no urine for about 3-4 hours or so. So as long as the baby is passing about 7 to 8 urines per day, I would be happy about it. Sometimes the babies do shiver a little bit. So if you hold the hand on the legs, it'll stop. It's normal. Sometimes there's a lot of startling reflex. So if there's a sound, the baby does that. That's a normal thing. Babies do frequently need checkups. That's very important. They are erratic. They are different. They are not machines. So you have to understand that you shouldn't ever equate a baby with an adult. They are different. So there are lots of things which seem abnormal but are basically within normal limits. But you need to know what is actually abnormal, what should actually alert you, when you should actually refer to a doctor. If the baby is not feeding at all, it's not one single feed. If the baby keeps on not feeding at all, that's a worrisome thing. If the baby is vomiting 90% of the feeds, whatever the baby is taking, the baby is gulping out. Or if the vomit contains yellow substance, if the vomit is projectile, these are the conditions when you need to be worried. If the baby has got massive abdominal distension, you can see for yourself that doesn't look right. That's abnormal. If the baby's breathing pattern is very labored, or the baby is breathing with difficulty, like, for example, the baby is breathing, that's bad. That's not right. If the baby is very lethargic, very drowsy, and you're pretty sure that's not right, then you should call a doctor. In fact, any mother, if she feels that her baby is not right, should contact her doctor immediately. If the baby becomes blue or yellow, if the lips are blue, lips are yellow, then that's an area of concern and you need to talk to your doctor immediately. So there are so many things actually which actually seem abnormal but are basically within normal limits. At the same time, you need to know exactly what is abnormal, because that is the time you need to call your doctor. Thank you very much. Please do keep listening to us, and if you find it right, you might forward this video to your friends and relatives. Thank you.